All right, we're going to do one last diabetes case study. A 49-year-old female presents for evaluation of worsening type 2 diabetes symptoms. She reports increased thirst, frequent urination, fatigue, and unintentional 12-pound weight loss over the last 2 months. She admits to inconsistent follow-up and has not checked her glucose recently. She has a history of type 2 diabetes for the last 8 years and hypertension. She is currently taking metformin 1 gram twice a day. So, pointing out things that are important to note here. She's having worsening diabetes symptoms, increased thirst, frequent urination, fatigue, unintentional weight loss, and inconsistent follow-up. She does not check her glucose regularly. Longstanding history of type 2 diabetes, and she's currently maxed out on metformin therapy. Upon exam, blood pressure in the office is 134/82. Her BMI is 29. Her labs are a hemoglobin A1C of 11.6, a fasting glucose of 312, and an eGFR of 82. So points that are important to note out here are a hemoglobin A1C of 11.6. This is considered uncontrolled. Fasting glucose of 312, which is also extremely elevated. So remember what our rules are for anyone who has a hemoglobin A1C of greater than or equal to 9. Despite if they are on any therapy whatsoever, multiple therapies, or if they're only on one therapy, anytime the hemoglobin A1C is greater than or equal to 9, the recommendation is going to be to start basal insulin. So, what is the next best step in treatment for this patient? Is it A, to continue on metformin, add glyburide, and follow up in 3 months for an A1C recheck? Is it B, to continue on metformin and add basal insulin? Or is it C, to discontinue metformin and start prandial insulin? Remember, our first choice is going to be to start basal insulin over prandial insulin. And definitely starting insulin is going to be our best bet. So the answer to this is going to be B. Basal insulin, again, is indicated for any time a patient has a hemoglobin A1C of greater than or equal to 9. So what education should be provided for this patient on starting basal insulin? Select all that apply. A, start with 10 units. B, increase by 2 units every 3 days until the goal is reached. C, achieve a glycemic control between 60 and 100. Or D, take basal insulin at bedtime. So the correct answers are going to be A, B, and D. The recommendation is to start with 10 units, to increase by 2 units every 3 days until goal is reached, and to take it at bedtime. Glycemic control, however, should range closer to 80 and 130. Giving patients too low of a goal can cause hypoglycemia.